Hi, I'm Dr. Thomas with The Joint here in Linwood, Washington, and I thought it would be nice to share a little bit about what I do during an adjustment and why. So I want to start off first by saying thank you for watching, and I also want to say that I've been a chiropractor now for 27 years. I'm a sports chiropractor, and I absolutely love my work. I love my patients and I love my team, Cindy and Michelle and Dr. Frazier. Thank you, Linwood patients, for being so helpful and being so kind to volunteer your time to be a part of our social media campaign. And yeah, thank you very much. So let's get started. I do full body adjustments because I really feel the need to have a full body adjustment is important for the need to eliminate compensation. And let me tell you what I mean by that. If a person comes in with back pain, for instance, and all I did was just adjust the lower back, they may have their foot out of alignment, like their ankle or even their little toe for that matter. They may have a shoulder joint that's out of alignment, and they may not even know that they have this misalignment. But the misalignment can be causing all kinds of disturbances with the nervous system and the overall function of the joint that causes problems with the way the patient moves, the way the patient's range of motion is, which could be more restricted than nice and free, and so on. When you have a misalignment in a knee joint, for instance, that goes undetected, the patient ends up compensating for it in one way or another. So that's why I feel it's important to do an overall assessment of the entire body, checking out every single joint in the body so that we can make sure everything is free and clear of misalignments. Now let's go forward with the actual adjustment. When I take my time to do my adjustments, I first get the patient nice and relaxed. We have the patient lay down on the table, and I take the time to let the patient relax and take a few deep breaths in and out. It's really important for them to decompress from the day and just get in tune with the actual adjustment. And that's why I do what's called nerve stroking. The nerve strokes are basically this type of movement along the spine while the patient is laying face down. So I'm literally stroking the back in a nice, gentle fashion. The reason why I do that is because most people, they're coming in from the hecticness of the day. They're all frazzled most of the time. They're stressed out from their day-to-day activities. And by doing the nerve stroking, I'm actually working with the sympathetic nervous system. The sympathetic nervous system is all about fight or flight. We got to get the patient nice and relaxed. And that's all about the parasympathetic nervous system, which is about relaxation and healing. So by doing the nerve strokings along the spine, I help the patient to calm down and relax and prepare them for the adjustment. As I go into feeling the spine, I'm literally feeling for tension of muscles on either side of the spine to help me to identify where I need to do the adjustments. And then we proceed right along with gentle maneuvers to help the thoracic spine to move into proper position, and even all the way down into the lower thoracic spine near L1, L2, which is the lower lumbars or the lower back area right through here. And as you see with my patient here, Greg, he's been so kind to let us use him as a demonstration, you'll see that I'm basically adjusting nice and gently the thoracic spine all the way down to the lower part of the back. And then I employ the use of what we call the drop table, which makes this loud noise, but really it's all about helping us to adjust the sacrum and the pelvis so that we can allow for better movement of these areas. It's very important to make sure your pelvis is well adjusted because that's your center of gravity. So you have, for instance, this side of the ilium or the pelvis, it can go forward or back, it can go external or internal. Same thing with this side. The sacrum itself, which is this bone right here, can tilt forward or back as well. And this is your tailbone. You would be amazed with how many patients come in and say, you know what, doc, my tailbone hurts. And when I tell them to point to it, they're actually pointing to their SI joints, which actually is this area right in here where the sacrum and the ilium come together. And that's why they call it SI for sacrum, I for ilium, and this makes up the SI joint. So when patients are actually coming in, I have to be very clear with them and specify exactly what they're actually referring to. Because a lot of people do actually come in saying they have tailbone pain when really all they have is SI joint fixation. So the drop table is very useful for helping me to free up the area of the pelvis, and it helps for the patient to have better movement in that center of gravity, which is what your pelvis is all about, the center of gravity. Side posture adjustment for the lower back. We're adjusting for either left or right misalignment in the lower back. And the way you address that is by putting the patient on their side like this, and the leg allows me to push it down this way. And that allows the vertebrae that have misaligned towards the right to come back towards center like this. That's how that works. I also think that the seated neck adjustment is a lot more comfortable for the patient because it allows them to relax and they get a sense of knowing what's going on. There's no element of surprise there. So I typically will adjust the neck on both sides, as you see, and then from there I do this back-to-back move as you're seeing now. The back-to-back move is pretty interesting because what we're doing is we're taking my back against the patient, and I'm using my legs to lift the patient, and the bottom of their pelvis and gravity is pulling them down as I lift them up. This allows for a nice traction of the thoracic and sometimes even the lower lumbar spine. I am a big fan of doing extremity adjustments for reasons I stated earlier. I just want to make sure that we're catching everything because, like I said earlier, if the knee is misaligned, it's going to create problems with the hips, the lower back, and everything else from a compensatory standpoint. So I always adjust the hips, the knees, the ankles, as well as the shoulders, the elbows, and the wrists, and even the fingers. It makes for a more comprehensive adjustment for the patient. A lot of patients wonder whether or not they need to have an X-ray before they get the adjustment. And that's a very valid question. I am able to assess the spine and the musculature around the spine through a series of orthopedic tests and neurological assessments that help me to determine whether or not X-rays are necessary. The other common question is whether or not an MRI is necessary. One of the reasons why an MRI would be necessary in a chiropractic office is if I was to think that there could be a herniation of a disc. And this is what a herniation would look like. It's where the disc is actually bulging into the space where the nerve root exits. And that creates a lot of pain for the patient. And only an MRI could visualize that. An X-ray can sometimes give us a clue that there could be a problem in that area because of the decrease in disc space height as the two bones come together on an X-ray film. If I did see that on an X-ray film, that could give me an indication that there could be a problem with the disc, but we would use, like I said, the orthopedic assessment and neurological assessing, and also the response of the patient to the treatment of the adjustment to make a decision later on down the line within a span of, say, 2 to 4 weeks. We've done that many times for patients, so don't let that be a concern to come into our office for treatment.
As an employee of The Joint, I work side by side Dr. Thomas. I see patients come in and miracles happen every day. It can happen for you.